Hi, my name is Dr. Tamisha Denis of Modern Smile and Implant Center, and I'm sitting here with Mr. James Holmes.
Welcome.
And we are going to talk a little bit about financing. And I think financing is very, very important when it comes to your dental work. I meet people all the time that kind of count themselves out of dentistry because they think they can't afford it. And the reality is you don't know if you can afford it until we have a chat. So we're going to talk about financing and some of the challenges that people face as far as credit and different things like that. And I want to explain again, and we have done this in other videos, the role of our treatment plan coordinator, and that simply means they're the person who's going to work it out so that you can afford to do the dental treatment that we recommend. So, Mr. James Holmes, and he just represents a few of our treatment plan coordinators that work with you after you've done your visit with me. We've discussed what kind of treatment you need, then you'll sit down and talk to James. So James, tell me why you think that dental financing or financing your dental treatment is important.
I feel that it's important because a lot of patients don't know exactly what dental treatment costs, and it gives them another avenue as far as flexibility. I usually tell the patients that 75% of their fear is actually coming in to see you, doctor.
Yeah.
And then the other 25% is of cost.
Yes.
So if we could eliminate that 25% with cost and make it affordable to their monthly budget, a lot of patients actually don't consider or ever think about financing dental treatment.
Mm-hmm.
But when I present it to them and make it affordable to their monthly budget,
mm-hmm.
they second guess it. It's like, you know what, I can do that.
Right.
And it makes them more comfortable with presenting with further the treatment.
And we talk about that a lot. We talk about the fact that not everyone can afford to do all of their work at once, but if you would love to do all of your work at once and it's necessary to do that, we can break it down into affordable payments that you would pay over a course of time, which we'll discuss in a little bit. And that makes it able for you to not only get healthier dental-wise, but it's not breaking the bank. And, you know, it's funny because I make the reference of a car,
mm-hmm.
but I don't think a car is quite as expensive as what most people are facing in dentistry. But if you think about it, you need a car, you have to drive it, and you're not going to necessarily shell out $15,000. In some cases, people have much more expensive cars like that. They're not going to shell out $15,000 at once. They're going to pay a monthly payment.
Mm-hmm.
So that's the way it makes affordable for a necessity. And as far as I'm concerned, dentistry is a necessity. If you're not enjoying eating, drinking, doing your regular life, you need to get it done, and you need to be able to afford it. So we're going to talk about some of those questions, and Mr. Holmes is going to kind of answer those questions. Now, one of the first questions that we have are, what are the different ways that you can pay in our office?
Well, the different ways you can pay in our office, normally first cash, you can pay debit, credit card, and then we have special financing where we have an in-house financing, or we can do outside financing. That's usually credit-based for good and bad credit. We all use Care Credit,
mm-hmm.
Lending Club, aka Springstone,
mm-hmm.
and Sunshine State.
Mm-hmm.
And those are the three tools that we like to use to make it affordable for all patients, no matter your credit.
Right. So, I mean, it's really your choice. It kind of works with you. I mean, most credit cards, they have pretty high interest rates, so
Right.
It may not be the most preferable way to pay. But, some people, that's the way they want to do it. So we try to be flexible with making that work in terms of how you would like to pay. And I think we've discussed this before. We do give cash discounts and stuff like that depending on how you pay. Now, another question we have, and I think you've already answered it, is what companies we partner with to do kind of a third-party financing payment plans. And I just want you to kind of explain why we use different companies.
Yes.
And what's the difference between them. Because I know some people in their office, they say, hey, I have a Care credit card.
Yes, yes.
So that's really wonderful that you already have it. But if you're kind of trying to figure out how to choose,
mm-hmm.
then, what are the different reasons?
Exactly. Well, Care Credit is number one. Lending Club's number two. Why? Because they offered interest-free. A lot of patients like to hear that word interest-free,
mm-hmm.
And it, if of course they can pay just for the dental treatment, it works out.
Right.
Those providers usually allow up to 24 months interest-free.
Mm-hmm.
And Sunshine State is another tool that we use for financing. They may ask for a small percentage down. Sometimes it may not be interest-free, but they work with all individuals. No matter what your credit score is, they look at your credit history. So I like using them for people who come in and says, I have bad credit.
Right.
No problem. We can get you financed. As long as you're willing to further the application and give us all the information needed, we can help you with those dental needs.
That's awesome. Because, I mean, we're coming out of some hard economic times, and I know a lot of people during those times, they kind of put dentistry to the back burner.
Yes.
So what happens with that is, you know, it's like maybe 10 years have gone by and it wasn't really a good time for you to have your dental work, and you have a lot of dental work that needs to be done, and it needs to be financed somehow. So that's really important that we have those tools. I think that, you know, it kind of brings it to the masses, so that most people can afford to do the things that they need to do. We're not talking about always cosmetic dentistry with veneers and stuff like that. Sometimes we're talking about necessities. You have pain, you have something bothering you, have a missing tooth you want to replace with a dental implant, and you need to be able to afford it.
Exactly.
Okay?
Exactly.
Awesome. So we already talked about why financing is important, but let's talk about when you have good credit. What are the kinds of things that you're eligible for? What can you kind of expect with good credit?
Usually with good credit, you can expect to get financed right away, usually within 60 seconds with most providers.
Okay.
And usually there's sky's the limit as far as your limit. They may, you know, allow you to get approved for $25,000 even though you only need $1,000.
Right.
You have it at your dispense.
Right.
That's an option.
Right. And so even if they get approved for that much, they don't need the whole thing.
Exactly.
They still have awareness. And a lot of these companies, remind me if I'm wrong, is they do also finance for other healthcare needs.
Exactly.
So, I mean, from breast implants to, I don't know, LASIK, right?
Exactly. So you don't just have to use it here. You can use it at other offices, which is a benefit to you. I know Care Credit, I spoke to a rep, and they actually, you can use it for your pets
as
awesome. Well. So for those pet lovers.
Awesome. Yeah, those veterinarian bills can get pretty high too. So what if you have bad credit?
If you have bad credit, once again, that's not a problem because, like I said, we can apply for the interest-free ones first, or we can go straight to the Sunshine State.
Right.
And like I said, credit does not matter with them as far as your score. They look at your history. So they'll find ways and they'll create a story for you to help that patient get financed.
Right.
As long as that patient is willing to give us all the information needed,
right.
I've seen him finance everybody.
Just out of curiosity, do you need to know what your credit score is before you apply for something like that? Is that necessary?
It is not necessary. A lot of patients, like I said, with the economy that just crashed and we're kind of rebuilding
foreclosures
now, a lot of people come in with, you know, not the best credit. So they're depressed because of that. However, if we can open up that light and show them that there's an opportunity for them, and also this helps rebuild their credit.
I was thinking that too.
So for those patients to say, oh, I don't have good credit, we can help reestablish that credit by financing this dental work, and it can help both things.
And I think I learned that a long time ago in my youth, that no credit is just as bad as bad credit.
Exactly.
So not using any credit cards or not having anything is just as bad because you have no credit history. So if you're paying your bills on time, and you know you have dental work and you're paying that every month, that actually rebuilds your credit to show you're credit worthy. And then in the future, when you want more credit, that's a little lesson from me. In the future, when you want more credit, you'll be available to have credit. All right, so we talked about good credit and we talked about bad credit. Now, you did mention this to a certain extent, but as far as monthly fees go, interest and terms, like how long you're going to be paying. Can you give us some examples of someone, and because I understand that there's $1,000 budget, $500 budget, $10,000 budget, $20,000 budget in your dental. So depending on what you need, I can see that there might be a variation in what's available to you.
Exactly. So that's why I like to talk to the patient to kind of find out what they're comfortable with without going over their monthly budget. So as far as financing, we've seen as low as maybe $75, maybe $50 per month. The interest rate can be between 0 to maybe 17% based on the credit history. And like I said, the terms could be as long as you know, we can do it for 6 months all the way up to maybe 72 months, depending on the size of what's being financed. So,
is it the less months, the less interest, or more months, more interest?
Every situation is different because we can give you 6 months no interest based on your credit, or it can be 12 months, you know, 12% interest based on the credit history. So every situation is different. I normally tell my patients, because I'm a sports fan, you can't score if you don't shoot.
That's
so
right.
let's go ahead and try for it and see what happens.
Right, right. And I mean, that's something I stress all the time. I say, listen, you don't know what your budget is because you don't know what you need. And until we do an exam and talk about what is it you need. Listen, I see people all the time and they say, oh, Dr. Dennis, I have the biggest hole in my mouth. And I look in their mouth, it's a tiny little thing. And I have people say, I have a small hole. And I look in their mouth and it's a huge gaping hole. So who knows what you need? I also joke, I don't have x-ray vision and neither do you. The reality is, unless we've done an exam, we don't know what you need. So don't worry, don't stress. We're just having a conversation. You come to the office, we sit down and we talk. I do second opinions a lot, but we sit down and we talk. We look at your x-rays and then we say, listen, is that what you need? And then we'll sit down and talk to James and figure it out. All right, one of the last questions that we're going to talk about is there anything you can do before you come into the office, even though we discussed a lot that you don't really know what your budget or your needs are before you actually come and get an exam. But is there anything that you can do that you can go home, sit at a computer and say, in the comfort of your own home, how much am I going to be able to be financed and, you know, those sorts of details? Is there any way to do that?
Yes, there actually is. A lot of our patients call me. I can do it either over the phone for them or I can send them directly to the provider's website and they can get it pre-approved so they know exactly how much they can afford monthly and how much they got approved for their dental treatment.
Awesome. I do find that we get a lot of patients who have previously done other things. We talked about plastic surgery, but a lot of times they'll get plastic surgery done. They're done paying that off, and they'll say, you know what, I'm already pre-approved. I already have a financing plan, and I'd like to apply that to my teeth. And I'm all about trying to make that a holistic beauty. You know, you don't want to look good down from the neck down and not so much in your mouth. It's really important. You got to have a smile you feel great about. So I know a lot of people come in that way. Is that correct? So they know more information than other people who've never done it. So that's wonderful. So really important, again, if you have a lot of financial concerns, we can make an appointment. We can talk. You can talk to me if you like first, or you can sit down and talk to one of our treatment plan coordinators like James, and he can sit down and go through a lot of financing issues. You know what? I find that when people do that, it makes my job easier because especially when you have a lot of work to do, let's say none of the teeth are good anymore, on the top and bottom, you have tons of work to do. I have a treatment plan for every budget, and it gives me direction to know, do you need multiple dental implants? Do you need root canals? Do you need crowns? Do you need to pull some more teeth than we expect? Fillings, bleaching, braces, fast braces, clear braces, Invisalign, whatever it is that you need. If I know what your budget is, I'm not going to give you something that is out of your budget.
Exactly.
So, you know, sometimes I'll say to James, James, what can we do? Because I want to help. So in the order to help, I need to know what you're working with. Now, if you don't want to do it that way, that's fine. But in whatever order that you do it in, we're here to work with you.
Absolutely.
So I want to thank James for sitting down and talking to us or talking to me today. I really appreciate it. And one last thing, we work as a team. We're here for you. We want to help you. So again, if you don't shoot, you don't score, right?
Exactly.
So let's make sure that if you're interested in a consult, you'd like to make an appointment, call our office. Make sure you check out our other videos. To me, an educated patient is the best patient. So you want to make sure you know kind of some of the things that you need. You don't need to know all the details, but it's nice to have an idea. Thanks for watching.